In 1978, a group of Palestinian American business people and community leaders came together to establish United Palestinian Appeal, a charitable nonprofit organization that would set out to provide immediate relief to Palestinians in Palestine and refugee camps in the Middle East. 4 years later, in 1982, UPA would confront its darkest hour yet. News of the Sabra and Shatila massacre traveled around the world, and the UPA family quickly honored its responsibility and raised funds for a local hospital in Beirut, supporting victims of the massacre. UPA's response to the massacre would soon mark a turning point, culminating in the establishment of the Emergency Relief Fund to respond efficiently and effectively to crises impacting Palestinians. The Emergency Relief Fund has since responded to many crises. These include the First Intifada and repeated Israeli assaults on Gaza, the tragic harbor explosion in Beirut, and the outbreak of COVID-19. Throughout the 1980s, in the aftermath of the massacre, UPA pursued long-term projects aimed at building the capacity of Palestinians to overcome crises and live dignified lives. These include the construction of Al-Maqasid College of Nursing in Jerusalem, UPA's child sponsorship program, which has since developed into the Children's Fund, and the University Scholarship Program, known today as the Mahmoud Darwish Scholarship Fund. In 1989, UPA became the first Palestinian American organization eligible for the United States Combined Federal Campaign. And for the last 8 years, Charity Navigator has given UPA its highest rating for financial health, accountability, and transparency. UPA also meets all 20 Better Business Bureau Wise Giving Alliance standards. By its 15th anniversary, UPA implemented humanitarian programs worth more than $1.3 million benefiting Palestinians and continued to raise funds throughout the 1990s to expand its programs in community and economic development, education, as well as health and wellness. Thus, in 1995, UPA facilitated the donation and delivery of the first mammography machine in the West Bank, benefiting the Ramallah Hospital. These milestones were soon followed by UPA's implementation of the Emergency Employment Generation Project in partnership with USAID, completed in 2004. Over the years, UPA grew from a charity initiative into a reputable humanitarian and development organization. Today, our work ranges from supporting childcare centers and community sports facilities to providing support to local hospitals and the launch of our small business development program, as well as mental health services in the Gaza Strip. More than 40 years later, the UPA family in Washington, D.C., and our field offices in the Gaza Strip, the West Bank, Lebanon, and Jordan remain committed to the promise of transforming Palestinian lives and empowering their communities.